Hi, this is Dr. Karen Perez, and today we'll be discussing about informed consent, what it is, what is a nurse's role, what are the intricate of informed consent. So stay tuned.
The consent must be given by a client or individual with the capacity and the competence to understand. So, a person over 18 years of age, conscious and oriented, can give consent. A legal guardian can give, and they can also refuse consent for an incompetent individual. And I know the word incompetent sounds strong, but incompetent could be that the person doesn't have the cognitive ability to understand. It could be that the person is in a coma. It could be that the person took some medication and is sleepy and druggy. So, a confused, disoriented, or sedated client is not considered functionally competent. So they cannot sign. If they're confused, if they're disoriented, if they're sedated, they are not considered functionally competent. So they cannot sign the informed consent. Minors who can provide informed consent. A minor who's married can provide informed consent. A pregnant parent, and I said pregnant parent because a minor that is pregnant and a minor who's a parent can provide consent. A member of the military, a person who is emancipated, minor can seek birth control outpatient. They can seek psychiatric services or inpatient voluntary admission to psychiatric facility, and this is without a parent. If they're over the age of 12, they can seek STD, HIV testing, AIDS, drugs, and alcohol treatment. So while they can seek this treatment, a child under the age of 18, if has sexual transmitted disease and again, sexual encounter with someone who's over the age of 18, then that is considered child sexual abuse, and a person can get into trouble. Group of people who can provide informed consent. And this should be that should be a different topic. So a client who's unconscious or injured in such a way that they're unable to give consent, a consent can be obtained from a family member. In a life-threatening emergency, consent is implied if no family member is available to give the consent. And this is in the example of a car accident. Say, for example, you have a client who's in a car accident, and they're a bad car accident. So they have bones broken, they have to be intubated, and they have to go into surgery. And they can't give consent because they're unconscious. There's no family member that can be reached. This is an emergency. They need to do the surgery right now. If not, the person's going to die. Then there is an implied consent. Emergency consent is implied if no family member is there. Most people do not walk with the advance directive on them. So if there's an accident in which the driver cannot speak and there's no family member and all of that, nobody knows about the advance directive. So the emergency team is going to do whatever they got to do to care for the individual. And so even if a person have an informed as a advance directive, it goes out through the window because it's not known of and this is an emergency. Now, if they can reach family members, family member can give the consent, they can ask, the family member say, no, they have a do not resuscitate, they do not want to resuscitate and all of that. They may ask for a copy, but that's it in an emergency. Now, the nurse's role. The nurse is responsible for explaining Well, I'm going to say this because I'm going to say it very lightly. The nurse, in terms of explaining the procedure, the nurse is not going to explain the surgery. It is the doctor that's going to explain the surgery to the patient. And that's his or her responsibility. However, sometimes, say for example, they may say, when you come up from out of surgery, you may feel pain, and the doctor should give that information too. You get some pain medication and give some basic information, because if that patient says, Nurse Jerry, I don't know what surgery I'm going to have, what's going to happen, then the nurse needs to call the doctor to come and further explain. All right. So there are certain things about the procedure, like for example, you're going to go to the waiting area, and while we're there, the doctor will come and see you, the fellow will come and see you, the anesthesiologist, then we're going to take you down in the operating room, and this is what's going to happen. But the nurse is not the surgeon, so they can't explain the procedure per se. The nurse's signature is a witness, and it confirms three things. It confirms that the clients gave consent voluntarily. They weren't coerced. The nurse's signature is saying that the patient's signature is authentic, that, hey, they're the one that signed the form. And three, the nurse's signature is saying the client appears competent to give consent. The client is competent to give consent. So the nurse's signature is a witness. And I think I mentioned this to you yesterday about when using interpreter for informed consent. Use qualified interpreter, refrain from using children. And when using an interpreter, it's good to have a pre-interview meeting with the interpreter first. I was able to witness one's interpreter. They have machine though. I worked in the emergency room, and sometimes they use machine to do the interpreting. But for a live interpret at the bedside, these people are trained. And so the patient, he spoke Creole. And apparently he was upset about something. Like, I don't know, what are you asking me? And the interpreter said it in the same tone as how the patient had expressed what he was saying. When the interpreter said it, I was like, what's going on here? But then I realized that he was just interpreting what the patient said in the same tone. What a pre-interview meeting would do is that it will give the interpreter just some basic information about the client that will better able to bring across what the healthcare provider needs to bring across. If you look in this picture, you see that I'm going to call her the nurse. It could be the nurse, it could be the doctor, the lady in the white and has the white jacket. The lady in the white jacket, she is looking at the patient while the patient is talking, while the interpreter is talking, and the patient is looking at the interpreter. So it doesn't matter if the patient is looking at the interpreter, the nurse needs to look at the patient when they are talking. Right of consent. Can refuse procedure after consent is signed. We've said that. Informed consent of pros and cons of refusing procedure. So if the person said, I don't want to have the procedure anymore, I change my mind, the patient should be educated. It should give them what the pros are and what the cons are. And if the patient still refuses, then the nurse should notify the healthcare provider of the client's refusal. And information should be documented in the client's chart. Now, this can be a tricky question because, like, for example, the question may say that Mr. Brown has been prepped for a vasectomy. Informed consent was signed and Atifen given. Later patient refuses surgery or change mind to do surgery. Which step, what should the nurse do first? There's so much things. I could say educate the patient. I could say notify the healthcare provider. I could say document in the chart, and I say all of that. And all of those are right, but which one would the nurse do first? And and that is educating the patient. But then say that educating the patient is not there. Would it be notify the healthcare provider, document in the chart, take the patient to the OR anyway, which is a no-no? And then the answer would be notify the healthcare provider. So again, you can see that the answer is not based on the question. The answer is based on the answer choices that you have. So understanding what the question is asking is paramount. The answer choices that are there determine which answer is the correct answer, because everything there may look correct, but which one would you do first? Documenting informed consent. So the following should be documented. Questions and concerns by the client should be documented. Notification to healthcare provider should be documented. When clients state understanding of procedure, if the client says that, I understand, that should be documented. If an interpreter is used, you want to document that an interpreter has been used, and you want to also include the interpreter name and also title. If it's not documented, it was not done. So always remember that.